నేను చెప్పొచ్చా ఓకే థ్యాంక్ యూ బాబు థ్యాంక్ యూ సో మచ్ వాళ్ళకి కూడా థ్యాంక్స్ చెప్పు గుడ్ మార్నింగ్ ఎవ్రీవన్ హౌ ఆర్ యు ఆల్ am I visible but I just can't see any one of you. So do you all remember what I have taught you all in my last class on last Saturday? That was regarding social context in medicine. Today it's though it looks it's not very important, but when I will be discussing with you all, then you will realize how important it is to know about the psychology and emotions of both patient as well as the attending physician, that is the doctor. We should have a relationship. If we want to treat a patient, then we should know the psychology and the emotional aspect of the patients so that we can um, treat them holistically. That is the whole purpose of having this session on psychology and emotions. As you all know that I am Dr. Sipna. I am a public health specialist and I am the professor in the Department of Public Health. Okay, this is for your information. Coming to specific learning objectives. So at the end of the session, all of you should be able to define what health psychology means. So definition of health psychology. Then you should be able to enumerate, list out the 3 psychological factors which affect the health. Then your other important thing is you should know the psychological diseases. So a number of psychological diseases are there. At least you should be able to list 3 of them. These are your specific learning objectives at the end of the session. Introduction. Introduction is what psychology, how psychology is related to health. So first we had to know what psychology means. It is the main concern of psychology is the behavior. It is the study of human behavior. Why someone behaves like that? Why someone behaves like this? So we always go on commenting, saying that like for example, the X person has behaved like that, the Y person has done like this. So why it has why it happened like that? Today, like in the morning when I was going through the newspaper, I found that in Washington there was like uh, gunshot of this police people. Then we just immediately think why someone wants to behave like that. So that is the psychology. It's the main concern of psychology is it is the study of human behavior. Why he might have behaved like that? What happened? What was the factor? So let's go through it. When we go through the slides, you will understand what is the importance of psychology in medicine, in treating patients in their behavior, like sick behavior or what are different types of behavior it may be. So which I taught you all in my previous classes. So it is a study of human behavior. So we want to know why they behave so, if they behave abnormally, and then it is concerned with individual person, its personality and behavior. They go together for every individual. then it is like we can differentiate a normal behavior from an abnormal behavior. We want to promote mental health of a person. So mental health usually depends on the physical well-being. If you're healthy and if you're physically fit, then the mental there is a mental well-being, mental health is protected. So it includes every type of human life and human relationship. That is about the psychology. Coming to definition of health psychology, it is an aggregate of specific altogether. It can be scientific contributions, educational contributions, professional contributions. To do what? To promote and maintain health of every person, of every individual. All individuals form a community. And then to prevent and treat illnesses. We had to treat them first, and also we had to prevent further occurrence. And then it is the identification of etiology. So these are the key points in definition of health psychology. What are the concepts of health psychology? There are different theories. As it is self-explanatory. Like for example, the first theory is adaptation. In adaptation theory, the person in his environment he tries to adapt himself. That is adaptation theory. And then the coping theory is trying to cope up. Like for example, you all had your NEET entrance exam. You could cope up with that exam. So that is the coping theory. Then the psychosomatic theory. Psychosomatic theory has to do with our mental health, how the mental well-being of a person. These are the important concepts of health psychology. Then psychological factors. What are the different psychological factors which are important, on which the behavior of a person lays? One is health behavior. The other is behavior sickness. When they are healthy, how do they behave? They behave normal because their physical health and mental health are in normal condition, so they behave normally. But when they are ill, then when they are on treatment, their behavior is different. Some of the patients whom I have come across, because of the illness, they go into depression because they think that something happened to them. Especially, I am the investigator of a phase 3 in tuberculosis vaccine regulatory trial. I come across the households of the TB patients. So, their behavior when they, in that case, when the TB patient comes to us, his behavior is different from his households who are normal. He thinks that because of his illness, he has lost something, and then not only that, he feels that he is stigmatized, he is discriminated in the family. So that is the behavior during illness. And once the illness is diagnosed, like for example, in the same example, wherein the tuberculosis patient is diagnosed as a tuberculosis patient, he is prescribed anti-tuberculosis drugs treatment. So when he is on the treatment, his behavior is different. Some of them are very much worried and they like to comply with the treatment, the prescribed treatment protocol, whatever it is. Like you all are in first year, so I don't want to tell you all in detail about the drugs and all. I'll just talk what you can understand. So treatment protocol. So when they comply with it, it is good. But some of the patients, after they start treatment, though the duration of treatment is long, maybe for 1 month, 2 months, etc., but when they feel better after 2 to 3 days, they stop taking treatment. So see the behavior during treatment. There are different types of behaviors in during treatment. All these are the psychological factors which affect the person's behavior. Scope of psychology. The psychology has now expanded so much that there are numerous branches of psychology which deal with normal behavior, abnormal behavior, then the educational aspect of psychology, then the social aspect, then the medical aspect, then child psychology, applied psychology, psychoanalysis. So there are different branches, numerous branches of psychology. These are the few which I have enumerated, which are very much related to our health. You all will come across how education is related to psychology. You will come across as we proceed further. Dynamics of behavior. The dynamics of behavior, the manner of acting or conducting oneself. That is the dynamics of behavior. How each one conducts oneself or acts at that given point of time. Those are the dynamics of behavior. So you all know, I'm again and again telling that the behavior is the result of all the factors, starting from physical factors, mental factors. They interact in complicated way. The interaction is in a complicated way which results in human behavior. The total reactions accessible to external observation. So the reactions are all accessible to external observation. Externally, when somebody observes you, what you are doing, it reflects on your physical and mental health. Those are the factors which are interacting in a complicated way. So thought and understanding are implicit behavior. The way we think over and the way we understand and the way we behave. It is a implicit behavior. This is how you means it is seen. The behavior is seen by externally. It is an external observation. So this is about the dynamics of behavior. Coming to the factors which affect the behavior. One is knowledge. Somebody who has a knowledge, he behaves in a different way. Some of them have strong beliefs and values. So based on their beliefs and values, they behave in a different way. Then the attitudes. It can be a positive attitude or it can be a negative attitude. So the attitudes and then the skills which an individual possesses, which are acquired. So all these factors affect the behavior of an individual. In addition, finance, money. If you have money, you're powerful. And then the materials. What are the things you have? Like your assets. Then it can be like physical assets or it can be in the form of like a big family, other things and all. Then the time is also an important factor which will influence the psychology of a person. If you are idle for a long time, you know there is a saying that idle brain is devil's workshop. So you go on think of something and then it may result in abnormal behavior. So time is important. Then the influence of family members. The family members play a very vital role in the behavior of an individual. Then your peer group, friends. So you should be careful to select your friends. So friends are important. The peer pressure. Then the co-workers when you are working. Like for example, I work here in the Department of Community Medicine and I also work in the TB vaccine trial. It's research aspect. So I have some workers who all are my co-workers. So I should know how to behave with them, how to work with them. All these are the factors and the opinion leaders. Some of them are so powerful. For example, if we want to immunize uh, children in a given village. In that village, most of the people do are not ready to accept vaccination for their infants. Then the opinion leaders, if they tell them, they listen to them. So the behavior depends on their opinion leaders. In the similar way, the health workers are at community level and they are very influential and whatever they say, the community listens to them. So see how many factors are there which affect our psychology or behavior of a person. Then the pervasive issues. What are the pervasive issues? These issues are there are certain norms that they should not do this, that they should not do that, they should do only like this, they should go only to that place. A girl should not go in the nights alone. All these are norms and the roles, I told you all in my previous class, the roles are defined. The males and females have different roles to play. So the roles are defined. And then there is ethnic discrimination. So each ethnic group, they want to follow their norms. That also is important. And so ethnic discrimination and then the poverty, all these are the issues. What are those issues? They are pervasive issues. Unemployment. If you are not employed after you qualify MBBS, then you have something. It is your health is affected because of your thinking that you are unemployed. In the similar way, the educational opportunities, though a student may be very clever, but she may not have adequate resources to go for further studies. So educational opportunities depends on so many factors. So if the educational opportunities are limited, some of them uh, have to they behave in a different way or in a healthy way. If they have all the healthy, then other important thing is about culture and social factors. Culture and social factors play a very important role on psychology of a person, which will influence the individual. Health behavior. Health behavior. If somebody behaves in a healthy way, they are not prone for diseases. To avoid diseases, what we have to do, everyone should behave in a healthy way and they should comply with the screening test. The screening test, what are the screening tests? The screening tests are some tests, the tests which are conducted before an individual gets a disease. Like for example, uh, a woman is screened regularly after the age of 35 years for cancer in the breast. Okay, that is a screening test. She is asymptomatic, but she is screened because she has reached that age wherein she is prone for um, breast cancer. So that is the screening test. I am telling in a very simple words because you just entered medical college. So asymptomatic persons, when they are screened, when the tests are conducted on them to detect whether they are having any hidden disease and to how to avoid it. Then other important thing is like behavior, coming to healthy behavior, sexually transmitted infections. These infections can be avoided by having sex with non-infectious sexual partners. I missed that non. Correct. STIs can be avoided by having sex with infectious sexual partners. If the sexual partner is infective because of the sexually transmitted infections, they can avoid having sex with him or with her. So, in the other way, they can also use the condoms. There are male condoms and female condoms available in the market. They can use them so that they can avoid sexually transmitted infections. The other important thing is we had to ensure that we had to avoid microbial agents resistance. So antimicrobial agents, it should be only used under supervision and they should be prescribed by the authorized person, registered medical officer or the physician. So it should be done only under supervision. Some of them what they do is whenever they are sick to avoid going to the doctor because they have to pay money for the fees for the doctor. So they avoid and they go directly to the pharmacy and then they buy some medicines and they just take it on their own. That is not a healthy behavior. So antimicrobials to be used only under supervision of a medical doctor or a healthcare provider. Look at this healthy behavior. See here in the pictures, you can see a woman who is just using only the boiled water. So it's good because this is a healthy behavior. This will avoid waterborne diseases. So she is boiling water and using it. It is a healthy behavior. Second, look at this practicing safe sex. No glove, no love. So this is like using the condoms. It's very important. Then comes your drinking and driving. See how the cop has stopped him because he is drinking and he is driving. So this is not a healthy behavior. Then coming to screening of the diseases, which I have told you all about just now in my previous slide, what screening means. I gave you all an example of breast cancer. So this is one of the program which is launched by Government of India for screening the population for diseases. Illness behavior. When somebody is sick, what do they do? Whenever someone is sick, like here, you can see her, she is sneezing. And what she will do? She will wait and see what will happen. Let me see. She will sneeze one time, two times, three times, or half a day. And then she will be waiting and see. That is one type of behavior, illness behavior. And second one, what she will do? She will call on a friend or a close person and ask, I am going on sneezing, what should I do? And the third one, very clever, smart. And what she is doing, she is seeking a medical care. All three different types of behavior during illness. That is illness behavior. Did you all understand what illness behavior means? Yes, I think you all could understand because I have put very nice, good pictures which I collected and I'm presenting to you all. Then treatment behavior. I told you all about drug compliance. Like for example, in a tuberculosis patient, the drugs are prescribed and the patient takes the drugs regularly and they comply. That is called drug compliance. Then they are also written back for the lab test as they are asked to do it. For example, at the end of treatment, they are asked to give the sputum for examination to see whether there are tuberculosis bacilli. So they return. This is a good behavior Then they cooperate with the doctor, all positive, cooperate with the doctor or the health system. All these forms of behavior are responses to stimuli. Do you all agree? Yes, you all agree. So the different types of responses. Physical responses. Physical responses are nothing but what we regularly go on doing. Like we want to brush our teeth before we go to bed. That is an habit which we cultivate and we continue throughout our life. That is physical habit. And then our skills. Skills. What are the skills which we have acquired that we try to do it by responding to the stimuli? For example, in my days we never had computers, but today I am on par with every one of you. I use my computer, I know to use my programs, everything. How could I do that? I could acquire the skill by learning. So, learning we will do it in the next class. Mm, and today we will talk about our psychology and emotions. So habit and skills, they are the physical aspect, they are the responses. Then the organic or like emotions, suddenly they start crying, suddenly they start laughing, they feel, oh my god, something happened to my uncle, he is in an ICU. So that is a feeling and tension. Oh, somebody has met with an accident. You start, that tension starts developing. And then these are all the responses to the stimuli. Intellectual responses are perceptions. You perceive something, what is good, what is bad, you perceive it. That is a intellectual response. And not only you perceive, but you also think whether it is right or wrong, what is right, what is wrong, and then you also reason it. Reasoning, you, when you go for some competitive exams, there are different formats and perception, all these are included. Means they want to check your psychological aspect of what you are at as an individual. What are the causes which affect a person's behavior? Environment plays a very important role in situations. For example, in front of a child, when the child start growing and the child is like 5 years, 6 years, and both the parents start fighting in front of the child. As the child grows, uh, and then she thinks that fighting is normal, it is, he or she will not consider that it is something abnormal, because she is or he is growing in that environment, and that child develops the behavior uh, based on that situation because the child has grown in that environment where the parents were fighting all the time in front of the child. I just gave an example of the person's behavior. In one of the situations I just elicited, which is very common for the domestic violence which we come across every day. And then the emotions and feelings. You all know that I was telling the emotion and feeling. It is the anger. We get angry when something doesn't work. Like, for example, the father wants to drop the child, and the scooter does not start because of some problem. Then the father gets angry, and the child is anger. All these things are like emotions and feelings, and the joy when you come to know that in the need you got a rank and you are going to become a doctor, and then you are going to join in medical college, you are very happy. That is the joy. And then hunger, especially every one of us at any one point of time we feel hunger when we don't eat. So those are the emotions and feelings which affect the behavior of a person, the psychology of a person. And the needs, what are the needs, desires, urges, and needs affected because of these needs, the psychology of a person is affected. If there are more wants than what the resources are, then they can start means they start uh, the robbery, because their wants are more than what they have. Then the desires, like they want to go to America to study, but they don't have resources. The desires are more than what they have. Then the urge is to become a super specialist. Man, then it depends, because of so much competition, everything. So all these are the factors, causes for our behavior, psychology. Then the motivation. Motivation can be inner force which drives an individual. Like it motivates you all to get good marks. You all want to pass anatomy, physiology, and biochemistry in first attempt, and you want to get first class. So you are motivated. The inner force in you, which drives to get through the exam immediately. And the intellectual perception is perception, thinking, reasoning, which influence the behavior. Making adjustments. How we can make adjustments and behave. Some of them may adjust themselves and then they behave normally by losing temper, some of them, and complaining all the time, complaining. So I will tell you one incident in one of the universities. The student was going on complaining, this is not there, that is not there, this class was not good, that class was not good, going on complaining all the time. Ultimately, one of the faculty will ask that student, okay, then if you are not satisfied with anything, then why don't you leave the university? Then he had no answer. So this is making adjustment again depends on the individual. But it's very easy to lose temper. It is very easy to complain. But if you get adjusted to whatever things are there, and if you want like basic things, okay. If you want something which is have to be provided to you is not provided, you can ask, doesn't matter, but it should not be continuous. Then they think that something is wrong with you, and then your mental health is not appropriate. They like to isolate themselves because they are not able to cope up with the things. They isolate themselves, and therefore everything, like if we ask them why you got less marks, they will tell, no madam, I did not have time to read. Means it's an excuse for failure, and then they accept failure also. They say, yes ma'am, I did not do well, because again some lame excuses. And then making amendments by changing behavior. Some of them, they try to change their behavior, adjust themselves, and then they start accepting their failure, and they want to make success in their life. So these are the making adjustments. Unconscious behavior. What is unconscious behavior? Without knowingly we behave like that. Individual is not conscious of his or her behavior. So unconscious behavior. Individual, then certain forces act to behave in that way. It may be because of the peer pressure. Like for example, 4 or 5 boys sit together and one of them smokes, and he wants other boys also to smoke. It's a peer pressure, certain forces which act on them. And then the perceptions, I told about the perceptions, and then the prejudice, notions, etc. It is all unconscious behavior. And then the certain important things may be forgotten because of this unconscious behavior. I know some of the people who behave like that, and they say for everything, oh ma'am, I forgot. Oh ma'am, I have done that. Then without a long book, they come to the class. to the clinical social case studies, practicals. I tell them to write down, and she will be staring at me. I tell, why don't you please write? And she or he will tell, no, ma'am, I forgot my book. I have no answer because it is an unconscious behavior, and only she or he can correct herself. Application of health psychology. Where all we apply psychology. The most important area where we apply psychology is in research. We want to find out the psychological aspects which are relevant to health system. So psychological concepts and knowledge to problems arising in health system. These are the studies which are being conducted, and they wanted to find out what are the concepts and the knowledge to the problems which are arising in the health system. This is totally related to health psychology, not to others. The health system related to health psychology. And the teaching material, non-psychologist in health system. So the teaching material is also important. They want to find out from the non-psychologists in the health system how best it is to teach about the health aspects related to psychology. Coming to the other aspect of class of today's class is emotions. If I don't complete, I will continue in my next class. You don't have to worry, but you have to understand the concept. What emotions and how they affect the health. Emotional health is very important part of overall health. You all know that. We were telling about the fear, anger, joy, happiness, hunger, all these are emotions. So people who are emotionally healthy are always they can control their thoughts, feelings and behaviors. Who are emotionally healthy and they can cope up with life's challenge. It is a skill. Emotionally healthy, to be emotionally healthy, it should be acquired. It is a skill. You have to think over, you have to feel and you have to behave in a healthy way. It is in your hand to be healthy. So that is the emotional health. So to keep problems in perspective and bounce back from setbacks. You have to do that if you have to move forward. And then you have to feel good about themselves. And you should have good relationships and a strong feeling to motivate human behavior. Got it? You should have a strong feeling to motivate human behavior. And it is characterized by both external and internal changes in the human body. In the human body, it is characterized by both. You can see the external changes, but internal changes are like after examination of the patient, you will come to know that how his emotional health is affected. Like for example, a couple is there and suddenly the wife, the husband dies and the wife is left alone. She is illiterate. All these days he was supportive and he used to support her and her family, and then suddenly he dies. Then her external, she can show up how she feels emotionally, but her internal changes in the body, they are, we can find out by her examining her when she comes with some complaint of, like for example, severe headache. She may come with severe headache, then we examine her and then we find out from the history that she has lost her spouse very recently, and that has affected her emotional health. So facial expression and changes in the posture, they are apparent, you can see. But internal changes, after you examine the patient, you will come to know that her emotional health is affected. Like for example, her pulse rate, when you see the pulse rate, it goes up. Then the respiratory rate, like dyspnea. Then the blood pressure goes up. Then there is tension And pain. She doesn't know where exactly the pain is, but she says the whole body is aching. So that is all psychological. Coming to definition of emotions, it is a sudden force surfacing in the mind. Like for example, I told her husband died because of a massive heart attack. So the sudden force has surfaced on her mind in response to what? To that situation wherein she lost her spouse. And that is a stimulus or a situation. And it is linked with the drives, the mind, the body starts working in her, and she will think of how to run the family, who will take care of her, who will take care of her children, and how her future will be. All these drives and the emotion always, it is also called affective state, because this is how it goes about the emotion. It is a sudden force which comes to the mind in response to a situation, and it is linked with drives, and it is also called an affective state. Major emotions. The major emotions which you all know are fear. NEET exam results are going to be published very shortly. You started to be in fear. You know you are done well, but still you have that fear whether you get qualified or not. And then the anger. Sometimes you get the anger. Suddenly you get the anger because I told you all, when the bike doesn't start and it is the time is going up and you have to go for a competitive exam. And the love, you start loving when you see the small children, when as soon as you enter the home and your siblings are there, you start smiling at them. You have that affection, love, and hate sometimes. Why you will hate? Sometimes you start hating it, especially when in the workplace you see people hating each other, and then the jealousy is also a major emotion. They feel jealous of each other. Then the mood, they are very moody. Then the joy, happiness, and the sorrow, very sad. The sympathy they show when one of our friends start crying, expressing her unhappiness, we sympathize, feel pity for them. And the lust and the grief, very sad. We'll just ask, what happened? How did it happen? How can we help you out? So these are the things which are the major emotions which we come across in a human being. Types of emotions. There are two types, major types. One is positive emotions, the one is negative emotions. When I have told you in my previous slides, I have shown you all joy, I have also showed you all jealous, I also showed you all hate, and I also showed you all the love. So what are the positive in this? What are the negative in this? The positive ones are those feeling of pleasure, joy, love, mothering. Those are all positive emotions. The negative, feeling jealous, sadness, sorrow, anger, hate, fear. They all are negative emotions. So positive and negative emotions, they go together in life. And so you should find out if when a patient comes to you, you should find out the emotion of that patient. Take a proper history and find out why it happened like that, why his health is affected, so that you can help him out and uh, make him feel happy for himself. Okay, that is why you have to take a history properly from the patient. And the negative emotions are like hatredness. You get hatred. I hate her. I hate her. I don't like him. This is the what the hate means. The sadness. What to do? Today my servant hasn't come. So you feel sad because you had to work. Then the sorrow. I'm very sorry. I lost my uncle today. He had a heart attack. That is sorrow. Anger. I told about anger. Fear. You are very much afraid. Like you will tell, yesterday there was a theft in the neighborhood. Oh my God, I am so much afraid of myself. I had to ensure that everything is secured properly. So that is the fear, nothing but the fear. All these play a vital role, important role in health of an individual. Specific emotions. The most common emotion which we come across is the fear. I was telling. Examination fear. Yes or no? You all agree. I know. It's so much fear when there is an exam. When they just announce that there is an internal test or an internal, they want to test you by giving some assignments or whatever it is, you start getting the fear, how you had to face, what you had to do, and anxiety, how to do, what to do, how to do, what to do. That is an anxiety. And the anger, of course, I told you all, other basic emotion. Love, a feeling of attachment. We love our children so much. That is an attachment. Attachment for the parents. The teachers and the students, the teachers love their students. That is also an attachment. It's like the love which we show for our students. Effect of emotions. What are the effects of emotions? Emotions can be a major barrier to communication. Because of the emotion, if you have the fear to talk, then your communication is affected. The emotion will become a barrier to communicate. You will not be able to communicate if you have that major fear. And the doctor should understand the emotions of the patient so that a mutual trust develops between the patient and the doctor so that he can treat the patient well, and also a trust is developed in between a patient and a doctor. That is how a doctor patient relationship sets in, and it usually begins, the patient, once he has the trust in us, then the patient will start talking to us freely. He will talk so freely, he will tell everything to us because he knows that we keep everything confidential. So, that is the trust, mutual trust, which should be developed. To develop that, we should know the emotions of our patient, and the doctor should always be cheerful and even temperament. We should not get angry on patients. We should listen to them. Then they think that there is someone who listens to them. And then you should be cheerful, happy, look happy. You should not put your long face in front of the patient. That is very important. That is the effect of emotion. So, undesirable qualities, I told you all, being moody, then emotional instability, easily upset, then expressing in the form of crying, going on crying, or laughing of no for nothing, just going on laughing, and then speaking loudly. That is also an effect of emotion. So one important thing I'll tell about the when our Indira Gandhi, Rajiv Gandhi, Diana, they all left us because of various things. They were tearful farewells. This is emotion. It is the expression of emotion by public when there was an assassination of our late Prime Minister Mrs. Indira Gandhi on 31st October 1984. Similar way, when Rajiv Gandhi was assassinated on May 21st in 1991, public started expressing their emotions by crying. And you all know about the death of Diana? Do you all know or you do not know? If you do not know, you can just uh, search and in the Google. The death of Diana on 31st of August has also resulted in expression of emotions in the form of crying by the public. In the similar way, when Jackson died very recently, in 2009, on 25th, everyone started crying. They were expressing their emotions, that is, tearful farewells. So I collected all these things so that you all will remember what emotion means, how emotion is expressed by people. Shall we stop here? We'll have our next class on roles of emotions in health and disease in my next class. For today, we'll stop here so that it is now time is getting up and then I have to leave. So thank you all very much. If you have questions, kindly post to me. I am Dr. Suguna, professor in the Department of Community Medicine of MIMS. So thank you all very much. Bye. Thank you, ma'am. Unique lesson. Nice lecture. Is my unique lesson.